All right, let's continue with this topic now. Creating access to quality healthcare services in Africa requires a sufficient number of well-trained healthcare workers. However, there is a huge gap between the skilled healthcare professionals that South Africa and other African countries need and the number that they have. A study by the World Health Organization found that there is a total of only 3.6 million healthcare workers across 47 countries, way below the number required to achieve the Sustainable Development Goal of universal health coverage. Now, let's discuss this further. We're not joined via Zoom by Dr Tadesse Mekonen he's a Group Executive Director, Clinical Education and Research and Development at Avacare Global. Doctor, thank you so much for your time this afternoon. Now, the quality of healthcare in South Africa, state hospitals, has been under the spotlight, I would say, for several years now. It's far from being something new, particularly as it relates to staffing crisis and other critical resources. Talk to us about the challenges that this country is facing specifically, and of course the continent, largely based on what the WHO is saying now in terms of those numbers.
Good afternoon, Unati. Thank you for having me. To put things into perspective, for Africa to achieve universal healthcare coverage by 2030, we need to have about 4.45 healthcare workers for every 1,000 people that will be serving. Africa at the moment is standing at around 1.5 per 1,000 people who seek healthcare. In fact, South Africa is much better than the biggest part of the continent, but healthcare staffing and specialized skill set is a problem everywhere in Africa, and that is even further compounded by brain drain, movement of people from a more rural healthcare setting to a more urban setting, and also to countries outside of Africa. So in general, Africa is really, really lagging behind in terms of achieving universal healthcare coverage, and this is primarily driven by a shortage of specialized skill set. To achieve that, a number of things has to get right. There should be accredited medical schools and healthcare science training schools. There should be regulatory institutions that actually ensure the quality of healthcare services are right to the population that we're serving. And it's also very important that there is progressive investment to make sure that there are high quality educational institutions that yield the quality of healthcare workers that we really need. Besides that, we need to keep our healthcare workers motivated and inspired to provide the quality of care that our people would require.
It would seem that, this is, of course, a very complex, industry. And it would seem now and again, you find authorities trying to just reduce it to a one solution base. I mean, just the recent statements made by the MEC of Health in Limpopo, that's highlighted, the lack of quality and capacity at most hospitals here in South Africa. But the question is, to what extent then do, foreign nationals, as an example, exacerbate, some of those infrastructures, some of those systems? I mean, we are talking here about a sector that, has a growing disease burden and also heavily under-resourced. So we can't possibly pin it to just one problem, can we?
No, Unati, the quality of healthcare services and access to healthcare services has multifactorial contributors to its low quality and to its access. Besides the unavailability of the training institutions, despite the inequality of the economy, the socio-economic status of the people needing the services, besides the migration of displacement of people from poor settings to urban settings, all this contribute to the lack of quality of healthcare services, besides the investment that is lacking in different parts of Africa.
If we had to start looking, Doctor, at just medium to long-term solutions, particularly as it speaks to the shortages of healthcare workers, what are we looking at? Of course, the quality of healthcare also being front and center. I mean, where you have healthcare workers in South Africa, as an example, you do find, as you've pointed out earlier on, that there is a lack of morale and some healthcare workers even venturing out to do other things, so-called moonlighting, so to speak. But where then do the solutions lie?
Yes, Unati. So the first and the most important thing would be to make sure that we have sufficient skilled resources, doctors, nurses, and midwives that are able to provide primary health care to specialized healthcare services. For this, the World Health Organization of the Afro region actually has laid down a clear plan, targets, and vision to be achieved by 2030. This has a multi-pronged approach to ensure that there are sufficient strategies in each country, to ensure that there are sufficient number of medical schools, nursing schools, midwifery schools, and to ensure that there is also a strong accreditation body, that the quality of education is assured. That is on one side. So the numbers should be right in proportion to the population that we are serving. We should reach for around 4.5 per 1,000 population. Number two, we need to get our healthcare workers moral better. We need to ensure that they received better incentives, better remuneration, and they have to be also protected in some circumstance of medical malpractice, where there is an intended error in practicing medicine. All this need to get right. Once that happens, when we have sufficient number with assured quality, and that the quality improvement processes in the management of patients, in the management of the healthcare service delivery systems is ensured, but at the same time, instituting incentives, better remunerations to keep them happy where they are would be very critical. To this end, there is this strategy, Workforce 2030, that is striving at achieving it in each member state in the African Union context from the World Health Organization of Afro region. Over.
All right, Dr. Mekonen, let's leave it there for now. Thank you so much for your time this afternoon. Really do appreciate it. Dr. Tadesse Mekonen, the Group Executive Director of Clinical Education and Research.